Simon is a 22-year-old male diagnosed with a spinal cord injury after a swimming accident while on vacation. His diagnosis was a type 2 Dens fracture. At the Spinal Cord Injury Center, he was diagnosed with complete sub-C2 tetraplegia. After months of therapy, Simon has shown great improvements and is able to walk 15 minutes independently. He still uses crutches when walking longer than this or on uneven surfaces. He also has some deficits in fine motor strength and grasp. Therapy is being continued to increase his motor functions and muscle strength. Helmet should be worn at all times when mounting, dismounting, and riding a bike to maintain safety. Simon should be wearing a helmet in this video, but we did not have one. I'm Brooke. I'm the occupational therapist today.
And I'll be Simon, the patient today.
Hi Simon, how are you feeling today?
I'm feeling pretty good. How about you?
Good. Have you thought more about your goal for leisure, trying to get back on a men's bike again?
Yeah, I have. I've been riding around with my friends, but I've been riding on a woman's bike, and it's kind of embarrassing. I feel less confident around them because I am on the woman's bike and they're on the men's bike. So I'd like to get back to the men's bike if possible.
I think that would definitely increase your confidence by getting back on a men's bike so your friends aren't making fun of you or decreasing your confidence level. I have a couple ways to try to mount a bike. If you're interested in trying them, they're going to be different than what you're probably used to, but I think they would help you get back to riding a men's bike again.
Sure, sounds good.
Okay. The first way we're going to try, you should always be on the left side of the bike.
Why is that?
The right side has the chain part, so depending on when you're swinging over, you could cut your leg if you're not careful. So you want to be on this side, and then the first technique is to lower the bike and then step over.
Oh, that looks easier.
And then pull the bike up. So do you want to test that out and see?
Sure.
We'll see.
It's a little high though. Like this, and hop on it that way.
Step over. Yep. And then
Yeah.
pull it back up. And you don't even need to be over the seat when you pull it back up initially.
I
You
could
swing your
move.
leg over and then
Okay.
move back to
I
sit.
just have to be careful of the bar at home. My bar at home is like higher than this, so just be careful with that one. I get. Okay. Yep. Maybe next week I can bring in my bike from home.
And we could include whatever adaptions we think we need.
When, is there any other techniques? Because that sometimes might be a little hard just to pull it down and up with a lot of like work with my hands and stuff.
Yeah, was this difficult to grasp?
A little
Bring
bit.
it up and
Yeah.
down. We could build up foam handles or try this other method. The other method involves a curb. So you're going to bring it over to the side of the hill or a curb, and then since you're higher, you don't have as far to lift your leg over,
Okay.
and then you'll be there, and then you can just sit and go.
Okay.
And then to dismount again, you can use a hill or a curb to get on and off. So if you want to try that?
Yeah, I'll try that.
Let's go over this.
Oh yeah, that's pretty easy too. But I'm not always gonna have a curb with me, so maybe I could try like a mix of both of those techniques to get on and off.
I think that'll help until you're more comfortable getting on your regular bike with increased muscle strength and range of motion.
So you said there's also some adaptive equipment that I can get.
Yeah.
Make it easier.
There's different types of handles that are built up with foam, so that'll be easier for you to grasp. And there's also different designs, so it could be a straight bar, it could be rounded more, whatever's more comfortable for you to grab onto. And they also make brakes that lock the entire brake, and then you can take it off once you're on it. So that way it won't be rolling away while you're mounting this.
Okay. So this stuff helped me. This will help me to get off and on the bike easier and things like that and grasp. But what if I want to mountain bike and the surfaces are uneven and I have to walk a little bit, but I'm not going to be biking the whole time, but I might lose my balance? Do you have any ideas for that?
So they make crutch holders, like seen here, and they attach to the front of your bike. So you could just put them on there once you're on your bike, and then when you get to the spot, wherever you need to stop, even if it's uneven, you'll always have your crutches. So that way you'll feel safe maneuvering on the uneven ground, and then you can just put them back on and get on your bike and ride away again.
Okay, that's awesome. I think these things will definitely help me get back to riding a men's bike, which I'm really excited about because I don't like riding on my women's bike with my friends.
It'll definitely help you feel more confident, and it'll just increase your independence with your leisure activity again. I also have this handout to give you at the end of our session, and it's just reminders about bicycling again, because you haven't been doing it as much, so this will be a good reminder. Always wear your helmet, don't wear dark clothing if you're going to be bike riding at night. Don't wear headphones so you can hear. That way you can increase your safety. Use hand signals to prevent getting
I
hit
could
by
probably get like lighting signals at nighttime that would turn so they know where I'm going.
Yeah. And then just always pay attention to the other drivers on the road. Make eye contact with them if you're unsure of what they're going to do, if they're unsure of what you're going to do. That way you really can connect and make sure that you're communicating with them properly. And then I can order the adaptive equipment that we discussed.
Yeah, I think all of those will help me a lot. I think I'm gonna order all of those.
Okay.
So would these be able to come in and then we could practice next week on my bike with all the equipment
Yep.
and things like that?
I'll order them in. If you want to bring your bike to the next session, we'll get everything on it and test it out because you said your bike does have a higher bar, so that we may have to make more adjustments for how far you lift your leg up just so you get over safely. But in the meantime, you could continue riding your women's bike and practice those strategies with the lower bar.
Okay, that sounds good.
I also have some other home exercise programs for you to work on to continue building up your muscle strength. You could use the TheraBuddy that I gave you in the beginning of treatment,
Sure.
and you could just continue to increase your muscle strength in your hands.
And that'll help more with like being able to grip easier and things like that, turning easier.
Yeah, especially when we have the built-up handles, it'll be even easier than this bike to grip. And then you can talk to your physical therapist to get more leg exercises to increase your muscle strength in your legs. So when you're swinging your leg over, you have more strength, and just bike riding in general, it'll give you increased strength and increase your exercise tolerance for biking in the future.
Okay. So you want to make it on while I pedal away?
Yeah, how about you try some of those adaptive mounting techniques before you leave?
I guess I'll try this one. Alright. Well, how'd that look?
It was okay. Just remember that your bar at home on your men's bike is going to be higher, so you may have to lift your leg up higher than you just did to clear the bar, especially your knee. And you did get on the left side, so that was good. Do you remember why I suggested left side?
So that I don't hit my other leg in the chain.
Yep, when you're coming around the
Coming
swingle.
over.
Yep. And how about the curb check? Can you show me that?
Sure.
And like you just did, you don't have to sit on the seat directly at first. You could always just stand and then kind of lean back to sit down. So that's easier.
Alright.
Any other questions?
No, I think I'm good. I think we can just practice this again next week with my actual bike and then adaptive equipment that we're ordering.
Yep, I'll order that and then we'll get on your bike and test it out again and make sure that you're good. And then you can start mountain biking again with your friends.
Oh,
so that
awesome.
that you're
I
back to
really
riding
wanted to
men's
get back
bike.
to that, so I'm excited.
Yep.
Alright, well, I'll see you next week.
Yep.
Bye.
Bye.
Ah!